Board. All righty. Good evening. Good evening, everyone. Thank you for joining us. This is part 3 of our obesity webinar series. And today we are going to be focused on the men, the fellas, and we have all of the fellas in the house with us this evening. We're really excited to have them. We thank you for coming, making the time for us, and also working with Dr. Sylvia to make this evening happen. My name is Tashi Jacobs, and I'm the program coordinator at Black Health. And I'm sure, you all have been on this journey with us. I'm sure you already know, but Black Health was initially the National Black Leadership Commission on AIDS, which was founded in 1987. And since then, we have evolved from just focusing on HIV/AIDS to encompassing many of the health disparities that plague African Americans. So we focus on sickle cell, we focus on obesity, mental health, breast cancer, what else? Prostate, diabetes, hepatitis C. So all of those things we want to address and just shine a light on, because we don't see enough of that happening for members of our community that look like us. So today we're going to welcome back Dr. Sylvia, and we've been working with her from part 1. Actually, we've been working with her for a couple of months, just organizing these webinars, and she's just been very instrumental in getting her ideas on paper and then now on the web. And we want to welcome Dr. Sylvia back. She's going to tell you a little bit more about herself and briefly about her story pertaining to this fight right now. And then she's going to introduce the gentlemen of panelists that we have.
Well, thank you so much, Tashi, for that warm welcome, and welcome again to our esteemed panelists. I'll go ahead and share my screen so that with you, and we'll go ahead and get started. And welcome to everyone who is here. I see we have over close to 30 people already, and I'm sure more will be filing in. And I want to first just go ahead and say congratulations and kudos to you for taking a step in your health, because being here right now is taking action and taking a step, and that's what it's all about. So I am honored to be here. As Tashi mentioned, I have been working, my name is Dr. Sylvia Gonsahn-Bollie. If you don't know me, I am a dual board certified integrative obesity medicine specialist. And what that means, I go beyond just medications and just the facts, and I really try to get to the heart of the matter and what's the root cause for you carrying extra weight, not just physically, but also in body, also in mentally and spiritually as well. And I do that through my coaching program in a telehealth practice, Embrace You Weight and Wellness. And I'm a best-selling author of Embrace You, Your Guide to Transforming Weight Loss Misconceptions into Lifelong Wellness. But really, my mission, my passion, my focus comes from having seen the personal effects of obesity in my family. My grandmother died from complications of obesity. I have treated thousands of patients throughout my over 10-year course in medicine, and seen how it can really, really just shorten your life. And working on the COVID front lines for me was the wake-up call, because I worked I'm based in the DC, Maryland area, and I worked in Prince George's County, which is the wealthiest Black county in the United States. But I worked in a subacute rehab facility or nursing home during the COVID-19 pandemic on the front lines. And there I saw my aunties, my uncles, like people that look like me. I mean, just loving, kind, caring people. But when COVID hit, so many people died. And it was because our health we already were sick. We were already disproportionately affected by all of the diseases that Tashi named, and obesity being one of the biggest ones that I treat. And so seeing that intersection was like, we need to do something. And so I'm so grateful for Black Health putting together, like putting their time, putting their resources where the talk is so that we can do these webinars. And we really wanted to do something that's different. It's not like just plain old facts. This is what it is. Because at this point, many of you have heard these statistics over and over and over again. And what can happen is when we hear statistics without context, without an understanding of what's really going on, we can start to falsely believe that they can't change. And how many of us, I think everyone on this panel is a living witness that they can change. I have personally lost 60 pounds and kept it off for over 8 years and been on a journey. Brandon's going to share his story. Rick's going to share his story. Dr. Corrielus is going to share his story. So we want to just be here tonight to give you the facts because you need to know, right? Miles Davis, one of my favorite trumpeters, he says, you have to know the rules of the game in order to break them. So like you need to know how to play the game so that you can make them work for you. And so that's what we're going to do tonight. So without further ado, I will go ahead and let these gentlemen introduce themselves, and we'll really talk as we go along. So let me share. So Coach Rik Childs, he is the founder of Health Renewal, where we don't quit, we finish. Dr. Sanul Corrielus is the founder of Corrielus Cardiology, and we're going to share our stories later. So I will go through the bios in the context of this presentation. Brandon Wood, he is a fitness superhero, he called himself, and I love it. And so, he is, we all belong to this group called the Overcoming Obesity Club, where we have spent over a year really inspiring people we're a group of people from different professions who inspire people to figure out your personal journey on your weight and wellness journey. So I'm really excited to share these people with the world. So none of us have any relevant disclosures to this presentation. Just want to remind you while we're here, we don't know you personally, even though we're going to do our best to give you information that you can use personally. So this is for educational purposes and informational, but we do want you to carry this information back to your health team, to people who can help personalize it with you. And we'll have information at the end for how you can connect with each of us as well, if you want to take the journey further. This is part of, as Tashi mentioned, our 4-part obesity webinar series. We've already gone through obesity as a medical disease, which we did with Drs. Daphne Bryant and Dr. Joynita Nicholson. Gave you these ladies, it was good, Tashi, wasn't it? We went through like the details of obesity and how it became moved from being a lifestyle choice to a disease. And so there's so much information that's helpful for you there. So check that out. It's on the YouTube channel. Tashi will share the links. The second webinar was the personalized care for obesity in Black women, where we went through the information as it pertains to Black women and how can you really personalize this for yourself, not just from a strictly physical perspective, but also what are the mental tools that you can use? What are the spiritual tools you can use? And Dr. Angela Clack and Dr. Carol Penn shared a wealth of information, and also myself as well. So today we'll be talking about part 3, which is personalized care for Black men. And at the end of this presentation, if you take nothing away from this, let's bust this myth that obesity is a lifestyle choice, that it's just calories in, calories out. No, it is not simply a lifestyle choice. It's a complex medical disease. And we'll talk about why it's affecting Black men the way it is and how it affects Black men a little bit more uniquely as well. What are the unique factors? So we'll talk about what's weighing on us, body, mind, and spirit. What do Black men need? Why do Black men need more than the standard BMI chart? So how can we really personalize these tools for you? And then also, what are specialized considerations for our LGBTQ community as well? And how can we release the weight and keep it off? So much more than calories in versus calories out. Now, to get us started, Brandon's going to set the atmosphere by us actually doing a 2-minute mind-body movement, and then we'll go into learning a little bit more about Brandon's journey and some tips he has to share with us. So, Mr. Wood, if you'll take it away.
Thank you, Dr. Sylvia. So in our Overcoming Obesity, the way we typically close our room is we do it through breath work. So to start off, we're going to do 5 deep breaths. We're going to breathe in, we're going to hold, and we're going to release. So let's get started. Take a deep breath. And release slowly. Breathe in. Take a release out. Breathe in. Release. Deep breath in. Release. And last one, take a deep breath in. And release. So if you have the ability, I'd like for you to stand up out of your chair. Hopefully the camera can catch me. I want you to take your hands, go above your head. Release them down slowly. Again, most of us have been sitting all day long. So as you go up, you want to elongate your spine, reach for the palms to the sky. You should feel a stretch in your forearms down through your shoulders. You should feel your core start to engage a little bit. Release down, releasing some of the tension out of your shoulders. Most of us are rounding our spine as we're sitting all day. Another one up. Remember to breathe as you're taking your hands and reaching them towards the sky. Again, you should feel it through your core, through your shoulders. As you stretch your palms out, you should feel it come back through your forearms and down to your shoulders. Release them down. I want you to reach over and go as low as you can. Hopefully your hands can touch the top of your toes. We're going to do a count of 10. I'll count. You should feel it pulling the back of your hamstrings and your lower back as we stretch it out from sitting down all day. I'm going to count backwards from 10, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly release yourself up. You should feel the back elongate. Now I want you to roll your shoulders backwards. We're going to do 5 shoulder releases to release some of the tension from that work day. So I'll count for you. 5, 4, 3, 2, 1. Now we're going to roll them forward. The same motion. We'll count to 5. That's right. 5, 4, 3, 2, 1. And the last thing we'll do is I want you to stretch your arms out to form a T with your body. And I want you to wiggle your fingers. And I'll count backwards from 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. All right, we can take our seats back.
Oh, thank you, Brandon. I definitely feel a lot more relaxed. And, breathing is such a great way to release that stress because it activates our body's natural stress relief system, the parasympathetic. We talked about that in part 2 in detail. So, Brandon, you are in the spotlight seat. So, Brandon, we want to hear from you. Tell us about your story. So here we have a pretty dramatic transformation picture, but because we've worked together through the past year and a half, I know that it was so much more than what we see here physically. So please share with us how it started, how it's going, and what you learned on your journey of overcoming obesity.
All right. So I started my health and wellness journey in the fall of 2006. At my highest, I was 454 pounds, and I was over 350 pounds from age 13 to 30. At the age of 30, I decided I wanted to make a change. It wasn't at the suggestion of a doctor or anybody. I just got tired of being fat, basically. Fat was all I had known. All of my memories as a child were attached to obesity and being a bigger kid. So at the age of 30, my wife was pregnant with my son, and I decided I wanted to make a lifestyle change. So I started my journey. I joined the gym, and I knew about working out because I played football in high school, but I really didn't understand the concepts of health and wellness. So it took me 2 years and 2 months. I lost 247 pounds, and I have successfully kept it off. The last 15, it'll be 16 years in the fall of this year. Actually, in the month of October is when I'll hit my 16 year mark. And for me personally, along the journey, I learned one about grace. I learned that it's not just about calories, but I also learned about consistency. Just showing up every day and trying to get 1% better each day. So, like, I never had a goal to lose 247 pounds. My goal was to just improve my health, improve my stamina, to be able to buy clothes out of a store that wasn't a specialty store. And along the way, I found the joy and the happiness that being consistent in my wellness provided to me. Along my journey, it took me about 4 or 5 years into my journey before I really got my nutritional piece of it dialed in, because those two things kind of go hand in hand. So I've always had consistent movement, but it took me a while to reprogram my thought process with food. And along the journey, food is one of the things that we have emotional attachments to. If we get a promotion, we celebrate with food, we celebrate with birthdays and anniversaries and things of that nature. So along my journey, I learned to reprogram my thought process and how I associated emotions and food. And then along the way, it's just refining myself, never getting complacent, consistently reinventing the program. About 8 years into my journey, I fell in love with running. And I went from a person that was never able to run at all to I've competed now 13 half marathons and almost 20 10Ks. So I debunked the myth that Black people don't run distance because that's just not true. So along the way, I've found some really, really healthy coping mechanisms in life, whether it's yoga and breath work, whether it's resistance training, whether it's cardio. So now movement and nutrition are just part of who I am. So I really don't consider myself working out. It's just my lifestyle and what I participate in on a consistent basis. And the results are what it is. For me, it kind of boils down to math. If the right side balances the left side, I'm always going to get the right answer. So for people who tell you that you can't change or you can't overcome some of the hurdles, I was 30 years old when I decided to make the change for myself personally. And I've been able to do it well into my mid 40s now. So when you really sit down and think about it, the journey starts with just deciding that you're going to do it for you, and being able to show up on a consistent basis. And consistency takes time. Give yourself some grace, and don't adhere to yourself to the societal standards, because each person's race is individual to themselves. And it took me a while to learn that, but now that I've learned that, I try to give the information so some people don't have to make the same missteps that I made along the way. But it really is a sustainable thing that you can implement and do for yourself. And then there's tools like the Overcoming Obesity Club on Clubhouse and webinars like this that you can work on refining yourself to really get to that point. So that's me. I'm complete, Dr. Sylvia.
I see that. Clubhouse, I'm complete. Thank you so much, Brandon. You said some really wonderful things that I think really can encourage the audience, like, do it for you. Do it for you. And you're never too old, because sometimes people say that. And I know Rik's going to come right in there and share some during his journey too, because you were 30, but Rik, it was even a little bit more seasoned than that. So these are such great tools, and consistency is not perfection. Consistency doesn't have to be perfect. So, all right, we're already giving y'all some juicy tips. Dr. Sanul is next, and he is going to share with us some facts. So just a little bit about Dr. Sanul Corrielus. He is a board-certified cardiologist. And one of the things I love about Dr. Corrielus is he does it a little bit differently also. He's an integrative cardiologist. So again, he focuses on the physical heart, but also the emotional heart and the spiritual heart, and just how our overall wellness goes together. So he's founded also, he gives back to the community. He started a nonprofit organization, Community Cardiovascular Initiative, that focuses on providing integrative cardiovascular health and wellness education to underserved communities. And so the goal is really to address the cardiovascular health disparities and improve health quality in the Philadelphia area where he's based. And he's also a best-selling author and dynamic speaker as well. And I have personally read his book, Healing the Spartan, a Breakthrough Plan to Heart Health and Longevity. And I tell you, I love to read, but this was not boring. It was good. I read it in one sitting. And what I loved about it is that it was just so practical. And it was such a great story, because she shares about his own experience of seeing his dad go through heart disease, spoiler alert, but he shares a lot that can really empower men. And I love the tie, like health and wealth, like your health is your wealth. So he really loves sharing that, a roadmap to wealth through health, because it doesn't matter if you have all the money in the world, as we'll talk about with the statistics here today, like even Black men who are top earners, but don't have their wellness intact, tend to have a higher risk of obesity, which then puts you at risk for heart disease and all of these things. So really, our health is our wealth. And so reclaiming that health is what he really helps you do as well. So Dr. Corrielus, I hope I did you justice, because there's so much more. I could take an hour just explaining how wonderful you are. But so let's talk about what's weighing on us, body, mind, and spirit. And so what are the multifactorial? Brandon talked about that balance, right? Like there's the equation, you know how young men are, I'm touchy-feely, I'm really girly. So but he talked about like the equation, but the equation is not just calories in versus calories out. The equation is energy in versus energy out. So what are those things? So when we talk about obesity, the first question is, y'all can type in the chat, what is obesity? Is it a serious and costly disease, a complex disease that occurs when a person has excess body fat, a chronic relapsing multifactorial neurobehavioral disease, or is it all of the above? Oh, type in the Q&A. I apologize, it's not in the chat. So let's see. So what is it?
Yeah, everyone can use the chat.
Oh, they can? Oh, great. Okay, thank you. Okay, this is a change. So I got D. Okay, yes, Giovanni. Okay. Okay, D, so Giovanni's right. Okay, Sierra's right. Okay, all of the above. Ooh, we're preaching to the choir today. Okay, well, great. So we're going to share some new things, and I'm going to let Dr. Sanul take it away and share with us some facts behind body fat. And, Drs. Bryant, they went really in detail about this, but for the sake of people who might have not seen part 1 and part 2 yet.
Thank you. Thank you, Dr. Sylvia. Can you all hear me? Awesome, awesome, awesome. Oh man, that's such a great introduction. It's always a pleasure to share the stage with you, Dr. Sylvia. I always walk away being enlightened, getting so much that I can take with me to apply on my day-to-day life. So I think we are all here for a treat. We are all here for a treat. And I know that we do have folks in there who already have some fundamental knowledge. So hopefully we'll be able to give you some more information that you can take with you to share with your own community. And so thank you again. I'm Dr. Sanul Corrielus. I'm your board certified cardiologist. I'm the CEO of Corrielus Cardiology here in Philadelphia. And Corrielus Cardiology is an integrative cardiology practice that really help empower the community, especially men, with heart health information so you can live your best life, so you can build your legacy. This is what it's all about. It's all about, for me, for you, it's about the legacy of our community, right? How can we leave our community better than we have found it? How can we contribute? We cannot contribute if we don't have our best assets all checked out, all checked in good terms, right? That is our health. And so I learned that the hard way. And like Dr. Sylvia mentioned, you know, my dad, you know, died of heart disease when I was in my late teen. I was a teenager. You know, can you imagine? This was my foundational years when I need my dad with me to help me through, you know, the teenage years into adulthood to show me the way. And yet my dad was not there for me. Can you imagine how devastating that was, and how devastating that can be to a community when fathers are not there to see that their children are growing and really mentoring them to be the best that they can be. So that there became my purpose to be there to share with you all, you know, especially men. How can we take our life back? How can we build upon that legacy? How can we fight the devastation of heart disease in our community? And so to me, and I'm going to share with you, there are many factors. I know Dr. Sylvia wants me to talk about many factors, but I would be remiss to really not touch on, you know, how our system teaches us how to thrive, how to really go and build wealth, right? You know, it's all about going and ace the tests, you know, go on and to build our career and build our, you know, wealth. But what about our health? How much education, how much emphasis is put on there? So we are all a victim of that until we become aware, until we make that awareness call to be able to say, my health is important. I'm going to take care of my health, especially my heart health. I got to do those things that are going to help me to build the best health that I can for my heart, and so that I can continue to be thriving and build my legacy. So it takes some intentionality. So when you do that, then you will be able to now build upon a foundation, the foundation that will give you the best wealth that you have and build the best legacy. So we're gonna talk to, okay, what does it look like? What does it look like? What are some of those things that really you need to start looking into? That's going to help to bring you that foundation. That's going to help you to build that wealth, the real wealth. And so the other thing that I want to touch on as well is really thinking about the biggest myth that we get taught as we grow up as men, especially. We are told that men don't cry. Men don't cry. What a big lie. That's another big lie. You know, men don't cry is really the biggest lie that we could ever have, because that teaches us not to be connected with our emotion, right? So to me, our emotion is the biggest really assets we have in terms of really making us connected with our own self, our own vulnerability, to show us our uniqueness, which is our strength. And that's, to me, that's where our wealth is in. Because when we know ourselves, we know our value, we know now how to build upon ourselves, how we're going to show up, how we're going to take care of our health. Because if we know ourselves, if we know our body, if we know where we are, that is the best way forward. Now, heart disease being a lifestyle disease, heart disease being connected to obesity, we talk about all those factors that are really leading to heart disease, right? So when we understand, so looking at this chart here, ultimately, we look at all these different factors that lead to heart disease, that are connected to heart disease being the end result of all those conditions that obesity is connected to, that leads to heart disease, right? So we see it as the type 2 diabetes. We see metabolic syndrome, which is a complex condition that it entails not just having cholesterol, your cholesterol that's elevated, and triglycerides is elevated. We know all about that, and it's all connected to what we eat, right? And also our waist size and our blood pressure. All that complexity, all those different factors lead to the metabolic syndrome, which is one of the big factors that's fueling heart disease. And we have the chronic kidney disease, the chronic hypertension in itself, and the sleep apnea. All those are different. All those different things that lead to heart disease. And heart disease, when we think about it, all those factors and also obesity, all those are connected to stress. All those are connected to stress. So when we are not in tune with who we are, when we are not able to embrace our nature, when we are not connected with our emotions, what we find ourselves doing, we find ourselves hiding, not being ourselves. We're living the biggest lie. And when we're living the biggest lie, what that does to us is really trying to really compensate. We're trying to overcome, and there is the source for stress. And stress, and those stressors are multifactorial. It's in the workforce, it's at home, it's everywhere we go. We are not being our true self. We are not finding ourselves. We're always trying to compensate. So there's a disconnect between our mind, body, and our spirit. And so there's this conflict within us that's really fueling the stressors. That's the source of the stress. And so when we are in the mix of that conflict, and so are the fuels for all these conditions that are leading to heart disease, which we know is an inflammatory disease. It's all about inflammation. So everything here that we have mentioned, that we're talking about, is all inflammation based. So the stress leads you to the need to find a release. And the release, a lot of times, we reach for to smoking. Smoking, again, another source of inflammation. And what we eat, especially the processed food, the food that are good to the taste, that are fat loaded, sugar loaded, and salt loaded, all those contributing to the sources to inflammation. And inflammation drives atherosclerosis. So it's almost like you're lighting a fire within you, the fire that is the inflammatory source that is the nidus for the plaque building in our arteries. So we talk about the arteries as the source of fuel to our heart. Now you have the artery that's been clogged with all this inflammatory milieu, with all the inflammatory factors, the high cholesterol. So now you have the nidus for heart disease and heart attack, and the end result is really a life that is short of the fulfilling the mission, the goal, your God-given gift, the God-given goal, your drive. So I know that we're gonna bring it all home, but what I wanna do is really start out with making that connection for you, to helping you understand that how did it all start? And how do you start to take control of your own health so that we can stop the cascade, the inflammatory cascade, the eating of these, the processed food, the smoking, all those preventable factors that are fueling the atherosclerotic process and the heart disease. How do we take it all back? And it all starts with embracing yourself, knowing who you are, spending that time and really understanding, okay, you are worthy. Have great, like was said before, Brendan mentioned, really have grace on yourself, being graceful, embrace who you are, embrace your nature, embrace who you are. And you are worthy. You have everything, all that you need, that your God-given gifts are all within you. So when you start from that point, then you are able to really find out who you are. You know yourself. When you know yourself, you spend time with your body, you know what your body needs. You listen to your body. Now you're speaking the same language as your body. You're speaking the same language. Now you're able to give yourself what your body needs. And so that's where we start now moving towards a point where we are connecting all the different elements that was touched on, the mind, the body, and the spirit all coming together. And that's where healing, that's where health and wellness starts. So, so with that, we're going to talk about self-care, which is huge. That's where it comes. That's where it leads us. And I'm sure the next speaker is going to touch on that, and we're going to circle on that. Self-care. Self-care is huge, but it's very complex. It takes a lot of time. It takes a lot of intentionality. But that's where it takes a lot of energy. But that's where it leads us. That's where it all starts, where you're gonna spend that time to take care of yourself, give your body what your body needs, so that the healing starts from there.
Yes, wow. Ooh, Dr. Sanul, you gave away all the secrets. No, but thank you. I mean, you touch on some very important points, and which we've talked about throughout this series, that yes, I mean, because again, we wanted to move past, right, just these statistics that we see here, where Black men, even though you have the lowest rates of obesity compared to other demographics, not including Asian population, but you still have 41% of Black men have obesity or classify as having obesity. And if you look at those numbers a little bit differently too, is that only 29% of US adults have a healthy body weight. Now we're going to talk about why it's not just the absolute weight, right? Because like Dr. Sanul mentioned, waist circumference, where your body fat accumulates is important. The amount of inflammatory conditions you have, so obesity related health conditions, all of that is important. But I think the points that you raise is that there's so much more than what meets the eye, just looking at the calories in versus calories out, that stress is a big factor, that this, constant quest for trying to make money and trying to fulfill the standard, the role of racism, the role of generational trauma. So there's so many things that weigh on men. So thank you for that. And then a special look at our LGBTQ community, which we've been talking about throughout this series, that when you look at gay men, while they're less likely to have obesity, there's a lot more pressure on it to fill, which Brandon's going to talk about, that hyper macho masculine role of being extra muscular, having a certain body type, and this can lead to eating disorders. So really being, as clinicians, as loved ones, family members, being aware of this. If you have people in your family that may be doing some, like dieting a lot or really loading up on a lot of supplements, really worried about particular parts of the body, being aware of that so that we do that proper screening, that we make sure that not all the health things that people are doing are actually beneficial for them. And then that intersection of bias, right? That because for all of us living in Black and brown bodies, we bear the weight of discrimination, which is ultimately stress, which ultimately leads to insulin resistant inflammation, all of those things, those diseases. And there has been studies that show higher rates of racism and discrimination are associated with higher rates of poor health. So it's important to see that. And then even in our LGBTQ community, that there's also workplace discrimination, there's sexuality bias and gender bias as well. And all of this leads to just your comfort of accessing healthcare, which we see in men in general, this general distrust of wanting to come into the healthcare, feel comfortable to have these conversations. And I know for Coach Rik, who's going to share his story, forming a team was really foundational to it, and a team that he trusted. And so Coach Rik, without further ado, please share your story.
Yes, thank you, Dr. Sylvia. Thank you so much. And Dr. Corrielus, thank you for your presentation. And my brother Brandon, thank you for the breath work and the movement. I definitely needed it so I could get started. So my name is Rik Childs. I'm a health renewal coach, a speaker, and the aircraft king. So my story, I'm not going to say my story, I'm going to say my queen story started in 2016. Both of us were 311 pounds together each, okay? And we had a host of health issues. So I'm going to set my queen over to the side and I'm going to continue on with the story. So in 2016, again, like I said, 311 pounds with a host of health issues. If I didn't do anything in 2016, Dr. Corrielus, I would probably be one of your patients right now, because everything that was in your graph was a part of my bad health, okay? And in 2016, where the light bulb went off was when my wife kept coming to me and telling me I needed to get my health together. And I had, I was okay with the poor quality of health that I was dealing with, because I had medication and I just had in my mind that it was too late. So let me jump back to 2016. 2016, I was 53 years old. So 53 years old, in 2016, my wife and I went into a fitness boot camp. We went into a fitness boot camp and both of us successfully lost 188 pounds together. She lost 66, I lost 122, and that was done in 7 months. And when I say 7 months, it was 7 months of consistent eating and working out consistently. Basic, simple, and plain. That's all it took. Wasn't no magic pills, wasn't anything but just showing up and doing the work. And it wasn't perfect because I had to get first out of my head, out of the pain, and then just out of not being in that type of environment, for so long. So as I moved through 2016, I got to the end of losing 122 pounds. And what I saw during that journey was so many people that was right next to me losing significant amounts of weight, putting it right back on. And when I tell this story, and as you can see in the graph from 2013 to 2016, I carried weight. I've been a big child all my life. We talk about obesity, but back in the day for me, I was called Husky. Okay. I don't know if anybody remembers that. Husky was the word. So now we're talking about obesity. We're talking about bad health. We're talking about what's related to it. So as we move forward, what I realized was I was on this yo-yo all my life, almost 50 years. And the light bulb went off when I realized that if I don't want to go back to where I was, I have to be as healthy as I can be and not worry about losing the weight. So that's where bringing a team of doctors would come in. And in doing that, the other thing I wanted to do was I wanted to get off the pharmaceuticals, the drugs that was giving me a quality of life during that time. So when I say health issues, I had sleep apnea, high blood pressure, AFib. It was so many different diseases, but the one disease that was getting ready to come into that list was pre-diabetic. And when my doctor told me that I was pre-diabetic, that's when I really took it serious and started getting my health together. So as we move forward, I put a team of doctors together, still had my general practice doctor, and I had incorporated a naturopath doctor, a holistic nutritionist, and all of these doctors, what they did was they gave me information from lab work, blood work, just different tests that allowed me to have one information to understand if my nutrition was working for me, if I was going in the right direction. Because the key for me dealing with arthritis in both knees, bone to bone, was controlling inflammation. Okay. If I don't say anything else and people do not get this from this story, control your inflammation. It can be done through your nutrition. Like Dr. Corrielus said, it can be done through managing your stress. It can be done through so many different things, but you must control the inflammation. So in doing that, I went through a lot of different labs, a lot of different work. And when I say this, and nothing to Dr. Sylvia, Dr. Corrielus, but I fired a few of my doctors because if they're not listening to you, if they're not on your team, if they're not giving you what you need, then you need to move on. And that's what I end up doing until I found the right doctors. And what I've been doing is I take that information, I build my nutrition, I build my supplementation, activation. I do all of these different things in order for me to be able at the age of 59 to be able to get up each morning and go work out 4 days a week. And I'm not talking about just walking around the track. I'm not talking about, just standing in place. I'm flipping tires. I'm lifting heavy weights. I'm doing all of these things with arthritic knees. I'm doing all of these things at the age of 59 because of my nutrition. That's what's key for me. And also mindset, the power of choice. So all of these things I'm doing has to be a choice. And that's where I had to get to at that point. And as you see the circle of the power of choice, health, and wellness, everything came to a full circle for me because 50 years of eating wrong, not taking your health as serious, even though I played sports and I did a lot of things, the nutrition part was not key for me. And what's so amazing now is 50 years later, the information that I have now would have saved me so much heartache as a child. I was heavy as a child, I was heavy as a teenager, and I was heavy as a young adult. And I went through those challenges, and it was because of the type of food I was eating. So the type of food I was eating may be healthy for Brandon, may be healthy for, Dr. Corrielus, Dr. Sylvia, but it wasn't healthy for me. And I didn't find this out until 50 years later. And that's how I, construct my nutrition. So there's so many things that come out of this journey. And I say mindset is so important. So as you can see on here, Clubhouse was very instrumental for me at a certain point in time in my life where I needed that community, because power of choice is about commitment, consistency, and community. And to have the long-term success to be able to lose 122 pounds and keep it off for 6 years takes commitment, consistency, and community, and a lot of other things. So as you see pictured, nutrition is so key to me and is essential. It can be basic, it can be simple and plain. And what it's about for me is putting energy in for recovery, for just being able to move and do the things that I do to control inflammation. If you were ever to come in my kitchen in the morning and follow me, you would probably look at me and say, wow, look at what he's doing extreme, because I do so many different things each day in order to do the things that I do. And it's a saying that I heard on Clubhouse, that when you're healthy, you have so many choices. When you're not healthy, you only have one choice, and that's to be healthy. And people don't realize that, you cannot buy health. You cannot buy, health and wellness. You have to put the work in. So another thing that really has worked for me is it became personal. I personalized my nutrition. I personalized my health and wellness based off of the team of doctors, based off of knowing my body, based off of hit and miss, by finding what works and then finding what doesn't work. And then the foundation, you have to build a foundation. The foundation is there. Like Brandon said, he lost 245 pounds. That's his foundation, because what he does each day, he doesn't want to go back to that 245 pounds. Like, I don't want to go back to 122 pounds, but it's so much deeper than that. Because when you look at Brandon and I, we're the 20%. We're the 20% that have kept weight off long term. And it, like I said, again, it's so much into our stories that we could probably do 20 webinars and still not be complete. So I just want to thank you for the opportunity. I'm Rik, and I'm done speaking.
Beautiful, beautiful, Rik. I mean, but stories are power, right? Our stories are power. Like, ancestrally, that's how our great grandfather, that's how they communicate. That's how we got the information now. And so, yes, it's good to have all the facts, but your story is powerful. And so thank you. Yes, the chat is just lighting up. So make sure you check in there. And so what we're going to do, we had so much information to share with you, but in the interest of time, we're going to move some things along, and I want to really address your questions that are going off in the chat. So one of the key things here, the next section where we're going to talk about was just moving beyond the BMI, because I get a lot of questions about what is healthy weight, what is happy weight, and when we're going to individualize it, and this is something we talk about a lot in Overcoming Obesity, it's really important to know, how do we measure obesity, right? Is it just by eyeballing? Is it by pinching the log handles? Is it using the scale? Is it using the BMI, the body mass index? What have we historically used? And I want to see what people put in the chat. So let's see. Ooh, there's no comments there. Okay, all right, it's covered. It was a little bit slow. So everybody's saying D, yes. So the body mass index has historically is what we have been using, and still is what is used to define obesity from a medical community. But we're going to share with you a few newer things and how to look at your healthy weight holistically and how to look at your happy weight holistically. So Dr. Sanul, you want to chime in here?
Yes. So we're going to move to, like Dr. Sylvia mentioned, we're going to move to these quickly, because we want to give you all a chance to come in with your questions. We want to answer your questions, because at the end of the day, really, like I mentioned earlier, it's really we learn what we're learning more and more. Obesity, healthcare is all personalized. It's all about your own personal background. That's what's really gonna drive everything that we say, everything that we do. So as you can see here, so if you're talking about BMI is, as you can see, can be very misleading, right? I mean, looking at the weight based on height, but as you can see here, in the slide, it says the excess body weight does not mean excess body fat, right? So as you can see here, you know, that if you're looking at the BMI, that can be very misleading. And so that's why even in instances, there's some folks who the BMI may not be elevated, and yet you can be at risk, at high risk. And so it depends on where the proportion of the fat is. Like we talked about the waist side, right? And we talk about, so we talk about all those other factors that really can be of influence, that can be, when we look at you as an individual, will be able to give us more information. So always, again, it goes back to knowing yourself and be able to advocate for yourself. Like Rik mentioned, he was able to advocate for himself, to get himself a team of doctors that were able to understand where he was at and be able to formulate a plan that was conducive to his individual needs, and thus be able to get him to where he needed to be from a health and wellness standpoint. Your health is your asset. So don't really take a one-size-fits-all approach. It's not sounding to be the way forward anymore. And so we need to take that into consideration and going forward. So I know we're going through the slides very quickly here, but I will end to say that as it's stated here on this slide, healthy weight assessment for Black men, adjusted BMI threshold assessment. So it take into account the waist circumference, the body fat percentage, and also the obesity related conditions that are part of who you are, that are part of your backbone, that are part of your health metrics, right? So that you put all that together, that's what's gonna give you what a sense of what your healthy weight is. So don't take, it's not a one size fits all. Really take your individualized approach, know yourself, know what your needs are, and advocate for yourself, advocate for your better health, and get the team of people that are going to be able to help you get there.
Love it, Dr. Sanul. And, you know, because really when we talk about healthy weight, that's the clinical facts, right? That's the data, and it's numbers, but it's not really who you are per se. And I think a lot of times what's happened, people put a lot of shame, blame, and judgment with those numbers. And especially when you're misled by thinking, oh, this BMI means that I'm unhealthy, without looking at the whole person. So thank you for that. And one of the key things we didn't get time to go over, but we'll be sure to share in the blog post, is that for Black men, actually, the BMI can tend to underestimate your healthy weight. So being aware that we really need to be taking this on a case-by-case basis, and where your body fat is so important, because this is an adjusted BMI chart that looks at if you are a Black man, non-Hispanic, that really maybe we need to start screening for these obesity-related diseases, right? That we're looking at this not for cosmetic, but we're looking at it for health, and we need to start screening at 28 instead of at 30, which is the standard cutoff for white men. And when we talk about waist circumference, that we need to start screening at 35 inches instead of 40 inches. So this is what some of the newer data is showing. But again, this is looking at groups of people, and it's not personalized to you. So it's just a screening tool for us to start doing the investigation and look deeper at your health with that team. And again, it's just facts. So Brandon was going to touch on briefly, which I mentioned, which is the happy weight. So everyone has that part. So facts is where we, the doctors, come in, right? You're like, this is the clinical facts. This is where we're screening you for things. But happy weight, nobody really should tell you that or can tell you that. You decide that for yourself. Like, where do you feel comfortable as a person? And this does play a role when it comes to men. So Brandon wanted to talk a bit about this, because it's not something that we talk about enough with men. We usually tend to think about it with women.
I'll hop in, Dr. Sylvia. And the gentleman that you have on the screen, uh, he is an 8-time Mr. Olympia, and his walking around weight was 310 pounds, and he was less than 8% body fat. And as a result of carrying all that muscle mass, he had to have open heart surgery. And if you saw a picture of him now, he's probably a third of the size that he is, and he has to use a walker and a cane. So the hypermasculinity about the ripped chest, the big back, the big arms, specifically in the African American community, I call them workout warriors, like the people that go to the gym and they just want to pack on loads of muscle because that's what Instagram tells you in shape is. No matter if it's fat or muscle, your heart still has to get blood through all that tissue on a consistent basis. And if you're overworking your heart, that can lead to early on heart disease. It can lead to strokes. It can lead to heart attacks. So, like we talk about fat and a lot of things in obesity, but you can be a person that perceives like the man on the screen to be in really, really good shape and still have the same issues as a person that has no muscle tone because you're carrying around way too much density. And the denser the muscle is, the harder your heart has to work to get that blood to flow through it. So, like, the other side of the conversation is the hyper masculinity of I want a six pack, I want to look like a chiseled Adonis, specifically in our community. That it can lead to some detrimental things from an eating disorder to body dysmorphia. You don't like what you look in the mirror. And Dr. Corrielus talked about it before, that emotional piece that men don't really address. If you're not processing and dealing with your emotions in a positive way, a lot of people will turn to food as a way to cope it, and then they're trying to turn that fat into muscle, and you can get into some really unhealthy habits because you're basing your manhood on a lot of superficial things, especially when it comes to the gym. How much do you bench? How fast can you run? How high can you jump? So there's a myriad of things that you see people along the journey. And if you stop and really start to delve into it and say, okay, explain to me why you're taking this approach to it. A lot of people are doing it for the superficial reasons. And if you don't really have something rooted and grounded in what you're doing, you can just lead to a host of other things along the way. So the Black men, we take the ego aspect out of what we're doing. And it really has to be for self. It really has to be something intrinsically that you're doing for the uplifting of who you are and not for the aesthetic reasons. And I would say probably 75 or 80% of the people that you meet on your wellness journey, they're doing it not necessarily for health reasons, but for the aesthetics of it. I want to look good in the dress, or I want to look good in the polo. And along the way, we develop some really, really unhealthy habits. And in closing out of it, the one tip I always give people, and they ask me about my consistency, and my Fitbit I've hit my goal 575 days in a row of at least 15,000 steps. And people ask me, how do I get consistent? And I just say that for me, it becomes part of my DNA because the consistency will get you further in life than the fads ever will. And consistency is a muscle that has to be developed. But if you show up every day as day one, you can never worry about streaks because every day is a new day on the journey because you're better today than you were yesterday. So the ego piece of it and the hyper masculinity, especially when it comes to Black males, if you take that off the table, it is easier for you to find that consistency in your journey because you're doing it for you. You're not doing it for any other reason other than I want to be better today than I was yesterday.
Love that, Brandon. And you touch on so many good points. Like you mentioned with that hypermasculinity, like there is an association with eating disorders and disordered eating, people around that. And a lot of people who are these gym rats and everything, the nutrition is not matching, and it does have effects down on. So really moving past just the cosmetics and really asking yourself, whose goal and whose standards are you setting that for? And I just also want to remind the healthcare professionals in there that we can't be so focused on the healthy weight that we're not talking to people about their happy weight, because the healthy weight and happy weight have to align, or else we're going to be talking past each other and really getting deeper and understanding, well, why do people want to, what are their goals? What is driving their goals? As opposed to just telling people, this is what you need to do, this is what you should do, and spitting out facts. That communication piece is so important. And like to Rik's point, if you don't feel like you can communicate with your doctor, with your healthcare clinician, then like to the left, to put some Beyonce in there, like it's time to get somebody else, because honestly, this is you. There's only one of you. They might have 3,000, patients. At one point I had 3,000 patients on my load, but I tell everyone, there's only one of you. So I need to listen to you and what you're saying, So, all righty. So Brandon already hit on this. And this was one of the questions Tiffany had asked, like, what's your number one transformational tool? What's your number one transformational tool before we answer some of the questions that you want to share? And Brandon, you've already said it, like understanding your why and what you're doing for you. But anything else you or Rik want to add here?
I would say my number one transformational tool is it's probably confusion, making myself uncomfortable. And the saying that I have written on my wall at work is, if you get used to being uncomfortable, you'll never be uncomfortable another day in your life. And like this journey, there are going to be uncomfortable moments in it. But if you become okay functioning in uncomfortability, you'll never be uncomfortable. So when you meet oppositions, when you have a setback or a sidestep or something doesn't go right, you don't get down on yourself. You just look at it as an opportunity to course correct and move forward. So every 30 days, I change my routine, whether it's the amount of cardio I do, the order in what I do my workout, something that I've decided that this is going to be my focus for the next 30 days. So my body never gets used to a routine, because every 30 days, I intentionally change it, because the intentionality that I use in my health and wellness journey, it makes it so that I have to put thought into what I'm doing. And it's worked for almost 16 years now. So I would say be intentional about being uncomfortable. And I'll land there.
Love that. Yes, Coach Rik.
Yeah. So for me, and this is for me, God is definitely my number one transformational tool. And I say this because when people see me and they hear my story, they see the weight loss, but they do not realize all of the change inside of me that has happened. And then that, God has given me what I needed. He continues to fill me up every day with direction and understanding. So many things that I share with folks isn't something I just came up with. These are things that I received through this 6-year journey, and I'm sharing it with people. But when someone asks me what, as far as where to start in the transformation, I'll say build a team. You have to build a team of healthcare professionals that's going to allow you to know where you are and where you need to be. Because if you don't know you have high blood pressure, or you don't know if you're pre-diabetic, then you don't have a point to start at. So I would say building a team of doctors to help you through the journey.
You have the chat on fire, like people are testifying the chat, Coach Rik. But yes, I love that. And I like your emphasis, because again, nerd here. I always say cool nerd, but what you're saying is supported by the data, like they're adding variety to, and Dr. Sanul can attest to this, adding variety to your workout. Someone asks about can I bring my metabolism back or bring that metabolic burn back? But that's one of the things is by basically changing up your workout routine, adding that resistance in there with the cardio, changing the foods, making sure that you're eating those foods that nourish you, those anti-inflammatory foods. Like, so these are all of the things in addition to some of the medical tools we have. So we'll round off by talking briefly about it. And maybe we'll follow the same format because we have lots of slides here. But what, Dr. Sanul, what are the top things you want to tell people? We'll give you top three things that you think are underutilized when it comes to how to lose weight and keep it off and live well. Honestly, we talk about so much about that number on the scale, but how to lose weight, keep it off, and live well. When we look at these factors that adversely impact Black men. So, the financial pressures, the stress, not living close to a park, not having access to a supermarket, all of these things that cause obesity, what are some things they can do?
Yes, thank you, Dr. Sylvia. That's a very important question. And I'll tell you, for me, it starts with the individuals knowing their why. And I think that Rik and Brendan alluded to it. Really understanding why. Why do you want to lose the weight? Because when you have that why, then nothing is gonna stand in the way. You'll walk miles to go find that healthy food that you need to eat. You'll be able to get out and go do that exercise. You're not gonna wait because, the weather is not good. It's snowing outside. You're not gonna get your exercise on. You will find a way. Having that why is very important to being able to lose the weight and keep the weight down. So some people, it's for them. For some other people, it's for a loved one. And for me, actually, what has kept me on my wellness journey, I can tell you, is the value that I embrace for myself. There are two values that are important to me. It's courage and it's compassion. Compassion, I'll start out with compassion. Compassion is about really being the best that I can be so that I can be of service to others. Because I believe that we are all here for a purpose, for a mission, to fulfill our God-given gifts, to be able to be of service. So I have to be obedient. I cannot be all about me. So I have to be able to be the best help that I can so that I can be able to fulfill that God-given mission, that God-given goal that I have to fulfill. So yeah, so it's about compassion. You gotta be able to see it beyond yourself, right? And courage. And so courage really, it's what it's all about, that really embracing who you are, embracing your nature, and do not shy away from it, because that's when you go through the hardship, when you accept yourself, when you're being vulnerable, then you are able to transcend all odds, transcend everything else. Nothing will stop you, nothing will faze you. Then you're ready to perform. Your true authentic self is able to come through, and that's what's gonna carry you through your journey. So I take those with me every step of the way, everything that I do. And I think people need to really find within themselves their why and embrace their values that will help them to be successful in their journey. It's not gonna be easy, but it will be done. Yeah.
Love it, Dr. Corrielus. And Brandon actually said, it said in the chat, you are one of a kind. You are as unique as your footprints. Like a coach, a doctor, a guy can help you, but it's your journey. So that courage and that compassion. And then really one of the things that you all touched on, which we see in the literature when we look at, for Black men, Black women, what's important is this element of spirituality. When we talk about compassion, right? When we talk about giving back, when we talk about God, however, but spirituality is important. It's an important part of who we are. And it does play a role when we talk about releasing the weight. that we're carrying. So physical weight, yes, but the emotional weight, the mental weight, so it's so important as well. And I love that you've tied that all in. Someone asked if you talk about it in your book. Yes, you do. So it all ties in as well. Now we are rounding up our time together. I was just going to take maybe 3 minutes, because one of the underutilized tools that we as a community, as Black people, don't use enough is medications, and don't use is bariatric surgery. So I want to just share with you some of the recent data. This actually just came out from the Obesity Medicine Association last year in September 2021. But I thought it was a very nice pictorial way at looking at, because so many times people, and here we have very successful, very effective lifestyle modification journeys here. But what Brandon and Rik said, and if you look at the literature, their ability to lose that weight and keep it off for a prolonged period of time is anywhere from 5 to 20% of the population. 20 is actually a high estimate. Some places say only 5%, right, are able to sustain significant, more than 10% weight loss for more than a year. And that's not to say it can't be done, but you see all the work that goes into it. So sometimes it is that people need extra tools, extra resources. So this is just showing that in terms of depending on how much weight you have to lose, how severe your obesity is, that you may need additional tools to help you get that initial boost. The most effective tool being surgery. And this is looking at it within 1 year. Now, some people, it can be done. Brandon said it took 2 years. Rik, it took 7 months. And it also is going to depend on how many times you've started and stopped before. Because let me tell you, when you lose weight, when you lose fat, the body wants its fat back. It wants it back. The body was meant to be a storage tank, a refrigerator. Fat is our primary storage tank and refrigerator. So anytime you lose weight, then you go back and you send your body, first of all, your body is sending out cues to get that weight back. So leptin, ghrelin, all these hormones. But then when you give it cues by what you're eating, what you're doing, what your stress level, going back to it, it tells it, put it back on. And next time when she or he tries to lose it, don't let it go. Because what are you going to do if you start having a leak of money loss? We've been talking about it. I like to think about it like money. If somebody starts taking stuff from your bank account, you're going to lock it down and put all these extra securities. And that's what the body does. So sometimes we do need tools. We need medications. We need bariatric procedures. And I think a lot of people, depending on what generation you are, if you're from that fen generation where there were like horrible side effects, or again, if you're coming with that mindset, oh, obesity is just lifestyle, I'm not trying hard enough, I need more willpower, you can feel like you're cheating. And if you get nothing out of this, it's not cheating. It's not cheating. And it never is to make a decision to empower yourself with the tools that you need, because metabolically, for some people, you will need additional tools. And how I like to think about it is like it's a race. So let's say you're at the starting line of a race and somebody comes up huffing and puffing and they have asthma and they're about to run this race. We would never tell the person with asthma, go ahead, run this race. You need to get down the line. Just, suck it up, work harder, stop it, do it. We would never do that. But we do that with people with obesity because we know at the level, depending on the level of, you want to say inflammation, we say insulin resistance, whatever those underlying hormonal disruption is going on, if we don't correct that, telling you to just eat less, exercise more, every time you do that is setting you at a disadvantage. So the medications, our bariatric procedures, they're not causing you to jump to the finish line. They're just bringing you to the starting line with everyone else who doesn't have obesity or who doesn't have an obesity-related medical condition. So I share that to say, I really hope it frees you up to let you know that sometimes you need these medications or even bariatric surgery as a tool. You're not cheating. You're not taking the easy way out. There's still things that you'll have to do to support these tools, but they are effective tools. And for Black people, we're underrepresented in the trials, first and foremost. There's a great new medication that just came out. Only 7% of the people in the trial were Black. And part of that is history, right? We're like, you're experimenting on me. But I also think there is also like this myth that we don't want it, we don't need it. And I think if we understand how it could help us, it would help a lot more. Now, there's also coverage issues. We're going to talk more about this in the last webinar of this series, where we're talking about policy and what is being done to make sure we have access to these medications, because a lot of them, people can't afford them, honestly, even if you do decide to do it. And then the last thing is bariatric surgery, our most effective tool for treating obesity and for putting diabetes into remission, for curing, if you will say, but putting it into remission is, again, underutilized. We have lower bariatric surgery referral rates, higher rates of complications post-bariatric surgery. This has to do with that team and that community, and less weight loss after a year. But that being said, no significant differences in how effective it is. So it still should be recommended to Black people, and this is still a tool for us. And, you know, I know it's not glamorous, it's not sexy. We want to all talk about how we did it on our own and we struggled. I said, Miss Sophia, all my life I had to fight, you know, I did this, but sometimes we don't have to do it the hard way. We can use these tools to help. So we'll just close up, and we have a little bit of time for questions. We've tried to answer some along the way. I'll check the chat, but just reminding you that your health is your wealth. Prioritize your health, prioritize it, control what you can while working on what you can't, working with what you can't. And then remember that medications, bariatric procedures are medical tools, not tricks, and they're not cheating, and they are resources to you as well. So with that being said, here is our dynamic team of men who have shared with you. I think we have a few minutes for questions. I'll check the chats, but make sure you get this, screenshot this, get their information. Dr. Corrielus, they each have a little bit extra here, but I'll start with this page and I can move on as you guys need it. But Tashi, I think you want to speak.
Sylvia?
Yes,
Can I hop in real quick? I was reading through the chat, and one of the questions was about sagging skin as you're going along on your weight loss journey. Mm-hmm. And I think one of the things that's really important is resistance training and just not focusing, because cardio is one of the things that's going to help you drop the weight. But long-term success, you need to add resistance training into your regimen for a couple of different reasons. You want to build healthy muscle, and resistance training helps to develop bone density. So as we age and become older, our bones don't become brittle and fragile because you're putting them under some stress. Now, I'm not saying you have to lift mountains, but doing a resistance training regimen 3 times a week in addition to your cardio will help with some of that loose, sagging skin as you're losing weight, because you're building muscle, which is a more compact version of the fat that you're getting rid of. So a lot of folks on their journey, they'll focus on the cardio piece and they're afraid to do resistance training because they think it's going to put weight back on them and make the scale go up. And some of that is important because you need to develop muscle to replace some of the fat. So if you're a person that's doing primarily cardio, try to work in resistance 3 times a week and just kind of do total body and focus a lot on your core because your core will help you in your cardio. Most people fatigue not because they're tired, but because their core starts to fail them. So you can do a whole webinar just on the combinations of cardio and resistance training and why both of those things are really, really important in conjunction. But if you find yourself having loose skin or you don't have that look that you're particularly going for and you're focusing a lot on cardio, do add some resistance training because it will make a difference.
Love that, Brandon. And it's such a great point. The other thing is nutrition is also important as well. And this is why that whole diet and severe calorie restriction without paying attention to your macronutrients in terms of your protein content in particular, because part of why the skin stretches, right, it has a protein in it, elastin in it. And so one thing is also to give it time, because it's been stretched out for a long time. A lot of times people lose it, they just want it to bounce back, but it's going to take a little bit of time as well. But also paying attention to your hydration status, nutrition content as well with your macronutrients. Sometimes I get questioned about, do certain supplements work? Now, this is a tricky issue because in terms of the randomized controlled trials, it hasn't been necessarily seen beneficial, but this is a place that ongoing research is being done, especially in the post-bariatric surgery community as well. And so another question too that was just here as we wrap up was anti-inflammatory foods. We've talked quite a bit about them, and do they work the same for everyone? Do they work the same across the board? Now, I know this panel has very strong opinions about it because we talk about it. And again, what we're finding there's a whole field, nutrigenomics is still pretty new and being done. So we could talk about some, generalities. I think I mispronounced that word, but you know what I mean. We could talk about some general things. And some of that would be, yes, your cruciferous vegetables, so things that have, so your broccoli, your cauliflower, anything that has a lot of vitamin D, K, things like that. I'll start us off. Turmeric is one of them. But again, you need to listen to your body. I know Rik eats specific for his blood type, and you need to listen to your body because certain foods may not agree with you properly, but there are some general things. And anyone else wanted to weigh in on anti-inflammatory foods as our last question?
Well, I think a lot of nuts, very important to have a complement of that as well. The almonds, walnuts, those are generally good anti-inflammatory intakes. In addition to the berries, all the berries are a great source of really a lot of antioxidants that you want to supplement with. But one thing that I have to say though, it's really a multifactorial approach, right? You are going to make sure that the milieu that you're going to work on is going to be conducive to a body that's going to be able to absorb the food, because a lot of times we find that people are focusing so much on the food and yet they're still leading a very unhealthy lifestyle that is really toxic in terms of stress producing. And so that's going to impair in the absorption of the food so that you are not really reaping the benefit if the food is not getting to where it needs to go. So you want to make sure that you touch on all the points so that you're able to get the optimal results that you're looking for. So that has to be very important as you're putting together the list of food that you're going to have.
Love that. And then last question. So a follow up from Dr. Smile. She said, you lost me out of micronutrients, I think macronutrients. So honestly, we talk a lot about what to add, but what to take away. We've talked about processed foods, refined, high sugar foods. Those are very inflammatory. Processed meats are actually listed on the WHO list of carcinogens. So some of the meats that people like that are processed, like deli meats, I'm not even going to say the B word because I might start a riot up in here, but bacon is listed on there. Yes, it's going to be a riot. I know. So we have to look back at some of those foods that are really heavy. So when you say, where do I start? I would say, what's the easiest thing to take out actually? Maybe because the way I look at it too is sometimes we're trying to put, like if you're sprinkling water on an oil fire, it's not going to go out if you're still fueling it with oil. So you need to really think about, okay, okay, well, what's something that might be that's really not helping me that I'm willing to try without. And then Loretta Mines finally asks, what about thyroid problems? We could talk a whole day about thyroid. The thyroid is one of the big metabolic boosters in the body. Hypothyroidism in particular is associated with obesity, but also sometimes when people are getting thyroid replacement therapy, if it's misdosed, it will also lead to obesity as well. So thyroid definitely has implications, and if people a lot of times they'll come and check, that's one of the things we'll check to make sure that that's not what's leading someone to store extra fat. So wonderful questions, Tashi. I keep telling you, we need the Black Health Obesity Conference so that we can have a whole day, because this happened again with with our black women in obesity, right? We had so many questions at the end. So Tashi, I'm putting it out there. We need our conference.
I agree. Dr. Sylvia, I will say, and I know we're running over and we're closing, but if you guys remember in the late 90s and early 2000s, Jared from Subway, they had a whole campaign about him losing weight, eating Subway sandwiches. And like that was a myth about it. So like the sodium that's contained in deli meat, specifically, if you're a person that deals with hypertension, and we're talking about inflammation and some of the other stuff that comes with cheese and some of the toppings and like mayonnaise and other things, deli meat per capita based on the sodium content and most of it because of the way it's preserved. And I work in the food industry, so I have like behind the scenes information. Subway and Jimmy John's and places like that are not as healthy for you as opposed to like a McDonald's or a Burger King as people think because of the content in the meats and some of the sugars in the bread. So if you're opting for like a sandwich as opposed to a burger, you're really not trading off a healthier option because of some of the other adverse effects that sandwich will do to you. So there's a misconception that stuff that's not cooked is healthier for you, but it's not always the case.
Absolutely. So come to Overcoming Obesity, because we'll talk about more of this. Like I think we had a whole room on this. And so, yeah, marketing does play a big role on what misleads us about what we think is healthy and what's not really healthy. So paying attention and knowing. So the more you know. But thank you again, Tashi. We'll respect everyone's time. Thank you to all the panelists, Dr. Corrielus, Rik, Coach Rik, Coach Brandon. Thank you, thank you, thank you, you bold and courageous and compassionate men, for sharing your truth and for the work that you do, because honestly, this is how we help people get free, by showing them what's possible and also helping them come into the possibilities on their own. So thank you. And thank you, Tashi, to Black Health as well.
Before you all leave and get started on dinner, I have a couple of questions in the poll. I have a poll rather for you all. Question number 1, only 29% of US adults have a healthy body weight. Is that true or false? Number 2, do you agree or disagree with the following statement? Obesity is linked to several diseases that are associated with higher heart disease risk. Number 3, do you agree or disagree with the following statement? Waist circumference is the strongest predictor of insulin resistance. So if you all could do those polls. And then I've also entered into the chat the Survey Monkey for this presentation. Put it again. Please complete this survey. So just kind of let us know how you feel about these programs, if they were useful to you, get some demographic questions from you about who you are, where you are, all of that good stuff. And this is really helpful. So please, please, please complete the survey and answer the poll questions. All right, and if you cannot see the poll, please let me know in the chat. All right, I know there's more of you that can do this poll. Like, at least, come on, a couple more. I know we hungry, but okay. I appreciate you. Come on, one more minute. Thank you. You click the survey first. Okay. So you can copy and paste the survey and you could continue to fill it out because it's lengthy. So you can continue to fill it out after this ends. But please, if you can answer the 3 questions in the poll right now, while we still have our panelists. Okay. So, uh-oh, did we lose me?
No, we can hear you. You're freezing a little bit, but we can hear you.
Can you hear me now? Okay.
Mm-hmm.
All right. Can you all see the results?
We can.
Okay. So for question number 1, 64% of you believe it's true that 29% of US adults have a healthy body weight. 36% of you believe it's false. For number 2, do you agree or disagree with the following statement? Obesity is linked to several diseases that are associated with higher heart disease risk. 7% of you strongly agree. No one disagrees. 50% of you agree. I'm sorry, 7% of you strongly disagree. No one disagrees. 50% of you agree, and 43% of you strongly agree. For number 3, waist circumference is the strongest predictor of insulin resistance. 7% of you strongly disagree. Another 7% disagree. 71% of you agree, and 14% strongly agree. Okay, so you want to weigh in on these questions? And this is all information addressed in the presentation.
Yeah. Dr. Sanul, you want to take number 1 that came from your slide?
Okay. Yes. Can you hear me?
Mm-hmm.
Yes. So absolutely, I think that you know, we do know that obesity is very prevalent, and healthy body weight is something that is elusive to many of us in the community and driving the disease state in our community. So goes without saying that 1/3 of the population can claim a healthy body weight, and so that's essentially based on the BMI index that we have now, although, you know, we have some, you know, reasons to think that this may be misleading, but so much so we cannot stress it enough that no matter where you are in your journey, you know, you should certainly continue to strive to maintain a healthy weight, and that is an individual is all individual plan that's going to get you there. And that's the point that we've tried to stress on that slide, and throughout. Just wanted to emphasize that.
Yes, yes. And then second one, kind of good follow-up to what you said, because this also came, is that obesity is linked to several diseases that are associated with heart disease risk. Yes. And most people, only one person strongly disagree.
Yes. And so again, we did stress out, point out so many conditions, you know, that are, you know, stemming from stress to obesity and subsequently leading to heart disease. And there's a slide that really highlights some of the points and some of the factors that are associated. And we should walk away knowing that heart disease is real. Heart disease is connected to a lot of those risk factors, and it's all tied to your healthy or unhealthy weight. So, so take care of yourself, take care of your mindset, your weight, and subsequently, you're going to curtail those risk factors that are going to improve your risk for heart disease for the long haul.
Yes.
Dr. Sylvia?
Uh-huh.
Yeah, I just want to add real quick. So when I lost the 122 pounds, all of the health issues that I had either was reversed or, as my doctor says, became non-treatable. So they didn't go away, but they were non-treatable. So I agree with it 1,000%. Once I got the weight off, everything got better.
Yes. And I can also say that even those who have heart disease, those who have plaque build up in their arteries, by reversing, changing their lifestyles and losing the weight and reversing some of those conditions like the diabetes and the hyperlipidemia, hypertension, you can have regression in the plaque in the arteries. And so it really is a direct correlation. So I'm glad that you can share your experience, Rick. And I have also seen it in actual cases in patients who have heart disease having it reversed.
Love that. Yep. We got the facts and we got the real story behind it too. Perfect. Hand in hand. The doc and the coach have shared. And then the last one was about waist circumference and insulin resistance. And yes, where your fat is located matters, right? And that's because, and that goes back to this slide, and a lot of times people won't measure their waist circumference properly because it's want to go up to the dress waist where it's the smallest, but you actually need to go down to the level of the belly button and just above your hips, and make sure you're exhaling. So also people want to suck it in, but take an exhale, relax, and then measure your waist circumference. And even if you're quote unquote normal weight, this has been shown to be your waist circumference is more tightly correlated with your risk of heart disease, with your risk of metabolic syndrome. So there's a certain thing in they call it skinny fat, or we might call it abdominal obesity, where people are normal weight, but they still have a lot of central obesity or central body fat. So this is important to measure your waist circumference. And honestly, someone was asking, like, what are we looking at in terms of using better tools than BMI? And yes, there are better tools. That is part of the conversation that's going on, and it's very complicated. I actually just wrote a piece for Medscape. As soon as it comes out, I'll post it on my blog, but where I talk about, it was an opinion piece just talking about the future of BMI, because it's complicated because obesity is still a young disease. It's less than 10 years old. And right now they need easy tools to measure, but using easy tools, if it's missing the mark, we still need to think of something better. So for now, it's here, but I don't think that's set in stone. And waist circumference is something that everyone can use that could help you to know, are you at are you at risk for these health diseases that we talked about? Because really what we want to boil down to from here, more than that number on the scale and obsessing over your absolute weight, is this is about your health. It's about your health and what are you at risk for? And especially as Black people, where we already have so many things stacked against us, what we can control, it is so important for us to control. So let's work on what we can control and let's do it together. You don't have to do it alone. We're here for you, community. So that's it.
All righty. Thank you so much for every one of you who attended. Thank you for being very active. Thank you for all of the love and encouragement that you all put into the chat. It's been very uplifting. It's good to know that we're not just here talking amongst ourselves, but thank you all for participating. We want to invite you to our fourth and final installment of the obesity webinar series, and that will be on September 15th. 6 p.m. Eastern Standard Time. So you all will be receiving an email and flyer and all of that good information from me, because I know I've been sending you all a lot of information. But please join us for that. Dr. Sylvia will return. And thank you, gentlemen. Thank you, panelists, for being here, sharing your story and sharing some great information with us. And I hope that you all found it helpful. We will have this information up on the YouTube. As soon as it gets there, I'll share it with you all as well. And for anyone that you know that couldn't make it, but you think this information would be beneficial to them, please share it. Please share it. Let them know we got some brothers, some educated, some brothers with experience, some brothers with information, some brothers who are relatable, who are telling their story, and can give them some good information that they can hopefully relate to and benefit from. So thank you all. Have a great evening, and we'll see you next time. I'll put my email in the chat in case anyone needs to reach me. All righty.
Thank you so much, Tashi. Thank you, everyone. Thank you, Dr. Sanul, Rik, Brandon. Thank you so much. I'll see y'all Thursday, right? Thursday.
Absolutely. Thank you for the opportunity. It was fun. I enjoyed it.
Oh yeah, most definitely.
Yes, your stories are so powerful. The world needs to know. I'm like the world's best kept secret. So I want to make sure that y'all get out there.
Well, thank you all. Thank you, Dr. Sylvia. Well done. And Tashi, thank you again for putting this all together. You all have a great evening.
You too. Get home and get rest, Doc. He's still at work. That's dedication. You came right here for us. Thank you.
Absolutely. Thank you so much. Good evening.
Good evening. Bye.